is when your prostate gland becomes inflamed, often due to infection or injury. In simple terms, it's when a man reaches climax sooner than he or his partner would like. And because it's linked to masculinity and self-confidence, many men avoid seeking help. Most people think premature ejaculation is just in their head. They blame stress, performance anxiety, or lack of control. But what if I told you sometimes it's not psychological at all? In fact, your body could be the real reason why it's happening. Today, we're talking about the physical causes of premature ejaculation, and some of them might surprise you. Before we dive in, let's quickly understand what premature ejaculation is. In simple terms, it's when a man reaches climax sooner than he or his partner would like, often within a minute or two of penetration, and sometimes even before. Now here's why we need to talk about it. PE is one of the most common sexual health concerns in men, and it's also one of the least discussed. And because it's linked to masculinity and self-confidence, many men avoid seeking help. When people think of PE, they imagine it's just mental pressure. But there are clear, medically proven physical reasons it can happen. And if you don't address the root cause, no amount of breathing exercises or distraction techniques will fix it. First on the list, prostatitis. This is when your prostate gland becomes inflamed, often due to infection or injury. Your prostate plays a big role in ejaculation. So when it's inflamed, your nerve signals or muscle contractions that control climax can get messed up. This can lead to hypersensitivity and make it almost impossible to delay ejaculation. The good news, if prostatitis is the cause, it can often be treated with medication, lifestyle changes, or targeted therapy. But it needs a proper diagnosis first. Nerve damage is another big one. The process of getting and maintaining an erection and controlling ejaculation involves a network of nerves. Damage to these nerves can disrupt the signal between your brain and your body. When the nerves are overactive, they may trigger ejaculation too soon. And when they're underactive, they may cause erectile dysfunction. Either way, your timing control takes a hit. We often talk about how testosterone helps in sexual desire, but hormones do more than that. Imbalances, whether low testosterone, high thyroid hormones, or other endocrine issues, can affect how sensitive you are or how long you last. For example, an overactive thyroid is directly linked to premature ejaculation in some men. Correcting that hormonal imbalance can completely change the situation for them. This one's often overlooked. Chronic pelvic pain syndrome is when you have an ongoing discomfort in your pelvic region without a clear infection or injury. The pain and tension in those muscles can mess up with your ejaculatory reflexes. This can lead to early climax. In these cases, physical therapy and targeted exercises can make a huge difference. Here's the thing, on the internet, you'll find 1,000 quick fixes for PE. But if the cause is physical, no trick can solve the problem long term. You need to identify what's actually happening inside your body. This means some medical evaluation, maybe some tests, and a personalized treatment plan. It's not about trial and error with some random advice. At Dr.Arora's clinic, we look at the full picture: physical, psychological, and lifestyle factors, so we can treat the real cause and not just the symptoms. Call us at this number or visit www.draroras.com to book a confidential consultation. Remember, PE is common, it's treatable, and you're not alone.